We call to order the Health, Education, and Welfare Committee. I would like to ask Representative Hicks if he could give the invitation, please.
Thank you, Heavenly Father, for this day that you're blessed us with. Lord, I give you all honor and grace for letting us be here today. And Lord, I thank you personally for letting me serve 2 years with Johnny Green here on this HEW committee. It's been a blessing to us. We just ask that you keep your hands upon her as she goes her way after today's meeting. But dear Lord, I just ask that you put your hands upon this meeting and let us do the best for the nation and for our citizens. In Jesus' name, amen.
Johnny Green. Present. Joyce Deere. Present. Randall Hicks.
Present.
James
Here.
Lucas Scott.
Here.
And so you have 5 present, 0 absent. 5 present, 0 absent. Constitutes a quorum. All business conducted will be official. This is the approval of the minutes for November the 4th.
Motion to approve the minutes with any corrections.
Motion by Representative Deere to approve the minutes with any corrections. Is there a second?
Second.
Second by Representative Scott. Roll call, please.
Joyce Deere.
Yes.
Randall Hicks.
Yes.
James Hicks.
Yes.
Lucas Scott.
Yes.
And Sherry Moore. 4 against.
4 in favor, 0 against. The minutes for November the 4th are approved. Now to the order of business. Mills Bay Fire Department is postponed on November the 4th.
Have they asked to postpone until January?
Make a motion to postpone January.
Motion by Representative Jennings to postpone January's meeting. Is there a second? Second by Representative Deere. Roll call vote, please.
James Hicks.
Yes.
Lucas Scott.
Yes.
Joyce Deere.
Yes.
Randall Hicks.
Yes.
And Sherry 4 against.
4 in favor, 0 against. The Mills Bay Fire Department is postponed until the January meeting. Rolling Hills Fire Department. Would you like to- You have your budget, anything that you'd like to explain?
Well, basically kind of the same thing as last year. We're trying to do a classroom, basically. Right now, we're limited, we've got a little bitty area that we're trying to train the guys in. So we're trying to actually do a classroom setting. Of course, obviously, if you have a decent classroom setting, it makes it easier to teach and easier to learn in better settings. And so that's what we tried to start doing, getting a better classroom and better training facility set up for the guys. So we're just trying to reach out and do everything we can do to try to get it accomplished.
Anyone back in last year, you said that it had enough money to be.
Then went to the concrete machine guy.
Any questions?
Yes, sir. So, do you have a fee for membership?
No, we don't have a fee. We are actually tax-based. We operate off of an ad valorem-based tax. So it's our day-to-day operations, basically. And
So are you not a rural fire department then?
we're a Title 19 fire district. We are, there's 3, I don't know if you're familiar with them or whatever, but there's 3 types of departments. There's Title 18, which are subscriptions and donations, and then there's Title 19, which is what we are, and we operate off of an ad valorem-based tax, which is a portion of everybody's property taxes in our fire district. And then Title 11 departments are basically your city departments that operate strictly off the sales tax. So we're not really a rural department because I mean, we cover, our fire district actually covers 3 cities. So it's a portion of Broken Arrow, a portion of Tulsa, and a portion of Catoosa that we cover that's actually in our fire district.
Yeah, and I realize you've been donating money before through this, but this is for a rural volunteer fire department,
Well,
this application.
I mean, I don't know what you consider rural. I mean,
I would
You're
say
not
that-
rural. I know you're right there at Catoosa.
right,
We're like Milfay,
right.
they're rural, Tiger Mountain, they're rural.
Oak Grove would be good.
See, and they're the exact same as us. They're a Title 19 fire district, just like us. So we cover rural areas. We're not just covering the city.
Yeah.
We don't receive any funding from any city whatsoever.
Well, then the reason I ask is that, normally there's a fee for membership into a volunteer fire department.
Right.
And so receiving the donation normally waive those fees to the tribal citizens. And so you don't have any idea how many citizens you serve.
I absolutely do not.
Thank you.
Any more questions? Yes.
I'm just trying to figure out. So what's the total estimate of 15.1?
No, what we've, 15.1 is basically, to try to get the framework, basically just the building set up. We did, 8,500 in concrete for a 40 by 40 slab, which 5,000 of that was funded through you all last year. And then the rest of it we actually received out of basically a fundraiser that we did by going in, and we actually made it work for Chili Bowl races and did the medical there, and they gave us a donation for doing that. And we put it towards getting concrete poured. So, but the 15.1 basically is going to be the starting of the building to get it set up, and then of course, we've got the interior and just the necessities that we'll need inside the building that we just estimated. So we do know that the building's going to cost us 15.1 because we've got an estimate on that to get it.
So you're requesting 5,000 for the building that you got 5,000 for last year.
Yeah. Just to continue, just basically continuing on to try to help fund it a little more.
Madam Chair, I'd like to make a motion to postpone this to next month so we can clarify exactly where they are, I
Motion by Representative Jennings to postpone until next month. Is there a second?
Second.
Second by Representative Scott. Roll call vote, please.
James Jennings,
Yes.
Rick Scott,
Yes.
Joyce Dare,
Yes.
and Bill Hicks.
Yes.
And Chair, you got 4 in favor and 0 against.
4 in favor, 0 against. That's postponed until January.
And I'll call you with the news meeting date.
Okay.
All right. Thank you.
Thank you. PR 19-138, a tribal resolution of the Muskogee Creek Nation authorizing the principal chief to execute a purchase order form between Muskogee Creek Nation and Blackboard Inc. for the purpose of providing a platform and accompanying services for the Muskogee Creek Nation Department of Education and Training. Sponsors Representative Hicks.
Motion to pass.
Yes, ma'am. This particular item on the agenda has been resolved through our finance department, and we called over to ask them to be removed, but we have the rest of this issue and it has been resolved.
Rescind mine. Then make a motion to postpone that.
Motion by Representative Hicks, postpone the please, second by Representative Jennings. Roll call vote, please.
Randall Hicks.
Yes.
James Jennings.
Yes.
Clifford Scott.
Yes.
Joyce Deere.
Yes.
Michelle got sworn in favor and Gerald.
Four in favor, zero against. Investment fund, I'm sorry, I didn't get back to Representative Hicks on that, I was messing it up.
Thanks, sir.
NCA 19-146, the law of Muskogee Creek Nation authorizing the expenditure of grant funds awarded to the National Congress of American Indians, NCAI, for the benefit of the Census 2020 project. Sponsor,
Motion to do pass substitute.
motion for due pass to substitute, is there a second?
Second.
Second by Representative Deere. Discussion.
So we asked for the substitute. I'm happy to answer any questions if you have about that, but basically we applied for a small grant from the NCAI to do some census outreach and education ahead of the 2020 census count. And we learned after award that those funds had to be expended by December 31st, which was not a realistic deadline for us. We thought that we could negotiate an extension, and NCAI denied that extension, but did ask us to apply for a second round. That application deadline is January 3rd, and they hope to make awards by mid-month. So we'll know in January whether or not we were awarded in the second round. So the substitution is to allow us, to prevent us from having to come back and ask for permission if we are awarded in that second round.
Any questions? Roll call vote, please.
James Jennings.
Yes.
Clifford Scott.
Yes.
Joyce Deere.
Yes.
Randall Hicks.
Yes.
Michelle got sworn in favor, 0 against.
Four in favor, zero against, that motion passes. NCA 19-147, excuse me, law of the Muskogee Creek Nation authorizing the expenditure of funds awarded by the Charities and Foundation America to Muskogee Youth Services Program. And I'm also the sponsor of this legislation.
Motion to pass.
Motion for due pass by Representative Deere. Is there a second? Second by Representative Scott. Discussion.
So this is for expenditure of a grant that we just received. Last year, we applied for a grant from the 1907 program, and we were awarded that. We just completed that grant, and they actually recommended us to receive an additional $25,000, so that's this funding that's coming in. We developed Muskogee Youth Wellness Days last year that were days where they could do traditional activities to promote wellness and health, and this year we'll be doing the same thing, but expanding that to modern games, but we'll be incorporating the Muskogee language into those games, so they'll have a little bit more of a cultural connection that way.
Any questions? Roll call vote, please.
Joyce Deere.
Yes.
Randall Hicks.
Yes.
James Jennings.
Yes.
Clifford Scott.
Yes.
Michelle got sworn in favor, 0 against.
Four in favor, zero against, that motion passes. NCA 19-148, a law of the Muskogee Creek Nation establishing the Muskogee Creek Nation Department of Education and Training revolving fund for the expenditure of all departmental income. Sponsored Representative Hicks.
Madam Chair, motion to pass.
Motion for read back by Representative Hicks, is there a second?
Second.
Second by Representative Jennings. Any discussion?
Yes, sir. Thank you, Madam Chair. The Education Development Administration resulted in the State Tribal Education Partnership and Tribal Consultation Work with School Districts. EDA is providing innovative cross-agency efforts that define and monitor tribal and public school success and access to the new Native Edge system. Our Native Edge accountability and support system creates a model of state, tribal, and school collaboration through cooperative partnerships, teacher professional development, administrator leadership training, technical assistance, and systemic capacity building. Some school districts within the tribal jurisdiction may receive state and federal funds for the services that Native Edge provides. We'd like to set up a revolving fund for EDA under the DET, which will allow the program to potentially receive state and federal dollars from public schools to provide these Native Edge services. Currently, EDA contracts with 4 consultants on the various roles above to work alongside schools while building internal capacity to grow our TEA expertise and receiving funds from public schools, which will help offset tribal funds that support Native Edge. Currently, EDA is working on a comprehensive school support and improvement grant alongside Wild Public Schools, which includes Native Edge. The $200,000 competitive grant is due this week and will be awarded in January. If RAL receives this award, EDA has the potential to receive nearly $100,000 from the grant. The revolving fund will then be utilized to house these funds, providing funding for consultants and services. The revolving fund may also hold later funds potentially awarded by other school districts. Basically what we want to do is we're providing all these services through step grants and YCPs, which are at some point in time going to come to an end. But there is grants and funding available that when we do work with these public schools, they can utilize the services we have to try through some of these state and federal funds that we could potentially pay our consultants and some of our staff costs with.
Thank you. Any questions? Roll call vote, please.
Randall Hicks,
Yes.
James Jennings,
Yes.
Rufus Scott,
Yes.
Joyce Hill.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor, 0 against, that motion passes. NCA 19-149, the law of the Muskogee Creek Nation repealing NCA 19-138, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the U.S. Department of Health and Human Services, Indian Health Services for Tribal Health Management and Development Grant Program, centralizing accreditation standards under the Creek Nation's Community Hospital. Sponsors Representative Jennings.
Motion for due pass.
Motion for due pass by Representative Jennings. Is there a second?
Second.
Second by Representative Hicks. Discussion?
Mr. Terry.
Thank you, Mr. Jennings. Thank you, Madam Chair and Committee. We were just extremely over-efficient and have passed this law twice. So we're going to ask to repeal this one. So thank you very much, and I apologize for the confusion.
James Jennings,
Yes.
Rufus Scott,
Yes.
Joyce Hill,
Yes.
Randall Hicks.
Yes.
Madam Chair, you got 4 in favor, 0 against.
4 in favor, 0 against, that motion passes. Down to other business. You have to go in there to executive session.
I don't need executive session unless you guys want to. So I'll leave that up to you guys. Well, I would like to start out my report today just by thanking Ms. Green for your leadership and all that you've done for the Department of Health over the last 3 years. I have been part of tribal health care for over 20 years, and I can't imagine that the relationship that the Department of Health has had with the HEW committee and the National Council could have been any better than what it's been over the last 3 years. I think we've tried to be as transparent as what we could be with our finances, with our operations. The committee has been extremely generous in their support and their questions in getting us what we needed when we needed it. And so I can say I've never worked with a finer group of people than what the HEW committee has been for me in my first role in this cabinet level of position. So I extremely appreciate the support and of what you provided for me personally. So thank you, Ms. Green, and thank you, committee. The 2019 Public Health Nurse Flu and Mobile Caring Van Partnership, we've done 119 flu vaccines to both students and staff at Midway and at Shakota Public Schools within the tribal boundaries during November. We continue to train the community health representatives to a new position of what we're calling a program manager, CHR program manager. And we're evaluating it. We've had a couple of staff in the CHR program that have been long-term staff that has indicated that they will be retiring in the very near future. So one of the things that is not out in the public is you just can't go find CHR managers everywhere. So we're going to have to train leadership into that role. So that's one of the things we're working hard on. We've participated in the Great American Smokeout last month, and so that was a very good event. The 802 ballot initiative, the state of Oklahoma received more than about 313,000 signatures to the state to support the Medicaid expansion program. 178,000 signatures were needed. I can tell you that Ms. Beaver and her staff and the clinics all worked very hard out promoting and getting the signatures. So we did our part in helping push that forward. The Oklahoma plan, Governor Stitt has said they're actively working on a, quote, Oklahoma plan. The state recently awarded a contract to Health Management Associates to develop options for the state to consider the creation of a health plan. One of the things that the governor has been indicating is that he wants to look at doing block grants for the state. And so one of the things Rhonda will be doing is working to make sure that we're assessing what the impact to the tribal health programs on these kind of block grants, and would we be eligible to getting our own block grant if that's the way it goes, and what's the effect on our rate. So anyway, there's going to be a lot to consider there. The White House executive order on protecting and improving Medicare for our nation's seniors. It says, in an effort to slow the momentum for Medicare for All, President Trump issued an executive order to strengthen the current Medicare program through traditional Medicare and Medicare Advantage programs. Through this executive order, the President hopes to achieve financial stability through alternative payment models, value-based payments, and that's something that has been ongoing for the last several years of Medicare trying to work with hospitals on reducing their payments and by the hospitals doing better with outpatient outcomes. So we're working hard towards that. The Indian Health Service, Admiral Miyake, the tribe sent a letter on that Chief White signed supporting that Rear Admiral Miyake would become the next Director of Indian Health Service. So that is something that we'll look to see if that happens. New providers, we had 3 new medical doctors join the staff in November. Eric Blackwell, he's a DO. He's at the Okmulgee Health Center, and he previously worked for St. John's and Hillcrest before coming here. He's just very excited to be here, and he's been a great addition. Rosalind Dean, she's located at the Okema Clinic, and she's very energetic as well. One of the things that we're excited about is not only is she a family practice doctor, but she also does OBGYN type visits, so we'll be hopefully being able to expand our prenatal service program down in Okema, and that's going to be good. And then we had Dr. Stillberg, who has started at the Eufaula Clinic, and he will be the clinic director there. And I've known Dr. Stillberg for a long time. I actually recruited him out of medical school probably 18 to 20 years ago. So we're excited to have all three of them. And we welcome two new dentists, Dr. Aaron Beaver. He's going to be located at the Eufaula Indian Clinic, and he had previously worked for Choctaw Nation. And then DJ Foster is also located at Sapulpa Indian Health Center, and so he worked for the Cherokees in Medina. We finished out very, very strong in third-party collections. For the year, we had one of the best months ever, over $7 million in third-party collections. I think that was the first time in our history we went over that. All of the trends and graphs that you see are all trending exactly the way that they should be happening. We had a meeting this afternoon with Mr. Darnell talking about some of the financial capital strategies that the Department of Health needs to happen. From a cash perspective, we're very, very strong right now. We think that within a few short months that we have a strategy to bring forward to alleviate all of the debt that the Department of Health had with the tribe from the bailout time, still making payments on the revolving account and getting Okema, hopefully, when Rhonda's team gets our lease done with IHS, that'll be paying off the Okema facility. So financially, we're extremely strong. Medical staff-wise, we're at 100%. We continue to get a lot of positive feedback from the physicians, new physicians in the emergency rooms. We now are growing our pulmonology clinic in Okmulgee. Dr. Boomer is, I believe, going to save us a lot of money when it comes to patients that have COPD and pulmonary issues, so we're really excited about that. We get lots of complaints on our pain management clinic, which whenever you start taking people off of opiates, you start getting complaints, so we know that we're doing our job when that starts to happen. Nobody wants that, but it's the right thing to do. With that, that's my report for the year. And once again, Ms. Green, we can't thank you enough for all that you've done for us. And I'll be happy to answer any questions if you have.
How about the employee clinic? How's it going?
The employee clinic is up and running. We're starting to see 8 to 10 people a day. I apologize, I didn't put this in here. I should have talked about it more. We've got Tracy Duckworth, who's our advanced nurse practitioner, who is over there pretty much full-time. We have Dr. Bart, who will be seeing patients on schedule over there, and Dr. Beach will also have a schedule over there. This clinic is going to be for anybody that has insurance on the Creek Nation insurance program. So any employees, you, your family, if your family's a dependent on the tribe's insurance, they can come to this clinic. So we're seeing Indian and non-Indian spouse, and as long as they are on our insurance plan. And so our goal right now is that if you call over there, we can just tell you, here's what time you can come over, or you can sit at your desk and we can save you from having to come and wait. I think that the experience most people have had, they come in and they're in and out there in 15 or 20 minutes. And even though that for the public, it may seem a little selfish, why are you doing the clinic just for the employees? What most people don't realize is what started this was that when we pulled the insurance cost to the tribe, 3% of our employees was creating over 50% of our cost. And so the tribe's healthcare expenses are so big that we think that we can do a better job with that 3%. There's 87 people that create half of our costs. So just think about those numbers. So we think that if we can get those 87 people and people like them into our clinics so we can start proactively managing that it's just going to drastically drive down the cost for our employees. It's going to be able to keep them in the work. And then we're also right now looking at a telemedicine option so that maybe you don't have to come into the clinic at all, that you can maybe sit at your desk and just get on your phone and FaceTime or whatever they do for these telemedicine visits. So we're getting very close to doing a lot of new creative things that we should be doing, and hopefully we'll be able to take those technologies and launch them through for our citizens and everybody into our clinics. But anyway, that's what we're doing today. Thank you for that question.
Well, the other question was, there wasn't a doctor back at the PA there, so Dr. Park and Dr. Beecher, both of them will be working there.
They will. They will both keep a schedule inside there as well. And with Tracy in there, she's a nurse practitioner, but she has Dr. Bart and Dr. Beats next door, so they're eligible that if she's got something she can't handle, that she can call them over, so that's kind of the plan here.
Thank you.
Yes.
Mr. Terry, I had a couple of citizens call about the Wetumpka Clinic. I guess their provider was out a week or something, and there was nobody down there to take her place, and I guess they had to change appointments and all that. Is there a procedure for something like that if they're out for that long?
Well, we don't like it to happen, and unfortunately what we did last year was that we took one of the nurse practitioners or PAs from Okema and had them go down and cover. But whenever when these providers at Wetumpka get sick, and it's at the last minute, and the person at Okema already has a schedule there, so you're in a position, do we either cancel a clinic there, or do we cancel a clinic here? So either way, we've decided that it's probably best for us to just direct them for those few days up to Okema where we've got everything. So we apologize when that happens, and one of the things that I've asked Dr. Beats to look at is potential us hiring a floating provider that maybe in the future, that when doctors are going to be out, we can send these people wherever we need them. So we think that we have the ability to do that soon. But we apologize with Wetumpka's, that's just an issue for sure.
Another question, have we got any treatments for complications from vaping?
I've had one request from the media to do a story about that I've asked Dr. Bart to do the research and the reading on that. I can't speak intelligently enough about the situation to really talk about it. I've heard positives and the negatives, but I'd be happy to get some kind of maybe report that we can send out in an email and just talking about what our position about it is. But I'm afraid I can't speak to it. If anybody else, Rhonda, or if you guys have any.
Well, we do know that tobacco prevention is going to the schools right now and speaking to them about vaping. In a recent meeting that we had in Denver with HHS, probably about 2 or 3 months ago, CDC was there and they were talking about how to have them actually figure out exactly what the cause is. They know that it has to do with with the particles, the air particles, or the particles of a substance, and they haven't got it tailored down to exactly what it is. They think is it THC that comes from marijuana, is that what the THC, that it could be from some of the THC, that people aren't using substances that have been approved. And so like when they go to the convenience store and they buy these substances that may have some THC in it, or they may buy it off the streets, what they're asking is that they don't put that in the vaping because it gets into the lungs and the particles are what's causing the lung damage and it's causing the death. And so they haven't been able to narrowly figure out what it is specifically, but that's as far as they go with it.
I was glad to see that you're going to some of these schools and stuff, because down in Wetumpka, I think they have a problem with that stuff. But it's more, more the younger people.
Yes, it's on high rise right
Yeah.
now with our teenagers.
And stuff, so y'all plan on going there and there, Willie, and them?
Oh, I'm not sure exactly where but I know that they have been making one around.
I know that they've been in Holdenville, and I think they've been in Wetumpka.
One more thing. Your cafeteria, is that for profit program, or how does that work?
It will be open during the lunch hours, and yes, we will sell food inside there. I think that our probably biggest customer is going to be employees.
Yeah.
And it was a way for us to be able to keep employees not having to leave the hospital during time. But so I don't know how profitable it will be, but yes, we will be charging bills for it. But.
Well, the reason I was asking that, because I did have some workers talking about, being real convenient for them, and also, cheap and stuff, so I was just wondering what that was working with, or.
It's not a money maker for us, for sure. It's more of a convenience item for our employees, and we make back most of, try to make back what it cost our expenses there. But food service is something that's never a money maker inside the hospital.
Thank you, Madam Chair. Thank you, Mr. Chair.
Have you got an ear doctor?
Audiologist.
In Coweta?
I have a proposal from a audiology company that would have them coming to Coweta 4 days a week and to Ocmulgee 1 day a week. And their proposal's a little expensive right now, so we're trying to negotiate that down. And Sid is also, he has a IHS audiologist that is currently at another facility that he's negotiating with as an employee. So we have both of those paths that we're running through right now. We got about 20 patients in Coweta that we need to finalize some of their hearing aids. So our audiologist that's in Eufaula has agreed to go down and help cover those so that we make sure that we don't drop the ball on those folks that we already have in progress. But hopefully we're very close to getting audiology.
Thank you. Thank you very much for being here today.
Thank you, Ms. Ruby.
I just want to thank, down to announcements now, but today, like you said, is my last meeting after 14 years. Working for the tribe, I worked for the tribe, worked for Chief Perry, Beaver, Chief Ellis, Chief Tyke, Chief Floyd. Started out as an employee and then decided to run for the council. And I've been on the health education welfare my entire time. And to see the changes and the growth, it really inspired me to see the Coweta Clinic being built, the old Kima, the Eufaula, River Spirit. I have a lot of things that, working for Chief Beaver. He told me when I started to run, you gotta have tough skin. And I live like sweetest talking. I've enjoyed working for the tribe.
I enjoyed working for all our departments, the health education department, Mr. Anderson. Loved his dad, worked with him for years. There's so many people I could think that are sitting out there that I appreciate so much. Mr. Koser, it's going to be hard, I'm not going to miss everybody, but I just want all of y'all to know that I love you. I enjoyed working with Chief and Second Chief. My committee, we've always had a quorum. One thing I regretted real bad was when Mr. Moore passed, and I didn't cancel my meeting, and James had to miss. And I felt terrible about that for not canceling our meeting and making it a better day. But that was the only meeting that he missed. And I want to say, Representative Hicks, Representative Jennings, Representative Deere, Representative Scott, I appreciate y'all so much. We've always gotten along together, and, you know, voiced our opinions. Might not agree with everything, but after the meetings, we shook hands and everything was okay. And I really, really appreciate that. All April, I can't say much. I've been with April for 8 years. That's my clerk. And if it wasn't for her, I don't know what I'd be. She kept me up to date with everything. And everyone, Alicia, Pete, Speaker, my co-worker, Mr. Randolph. I know there's a lot of difference in our ages, but we could talk. We could discuss things. Paula Osborne, just got to know her, and she's a dedicated worker. And to all of you here, I appreciate all of you, and hope that the next 4 years, next 2 years, is great and you keep prospering. To see everything that has, especially in education, how we have grown is really, really inspiring to me. And I worked with Greg when he was an employee, when he worked for your father, Gordon. And after I saw all the growth in different departments, you know, and I couldn't, the last 2 years was like, I can't make all these meetings. I can't go to JOM this today, go here tomorrow. It was getting kind of difficult. But this is the time. I've got to sit down and someone younger come in and take up the work. So I just want to thank all of you that are here today. Thank you very much. She reminds me, cookies and punch. So everyone has some cookies and punch on that. Are there any announcements?
I don't have an announcement, but it's been fun, y'all.
Yes. Yes, James and I have been on the committee since 14 years ago, been with him on the same committee. And he's been a right-hand man. He's been in the college, always reported on the college.
Thank you.
Thank you. Motion for adjournment. Motion by Linda Jennings, I look here, all in favor, say aye. All opposed, same sign. I'd like to ask Representative Beaver if you just give a
Dear Heavenly Father, Lord, I thank you for this day you've given us, Lord. Thank you for being with us and guiding us through this meeting, Lord. Lord, thank you for our sister Johnny, Lord, that you have given her 14 great years on council, Lord. And Lord, just ask that you continue looking after her, Lord. Look after her and her family, Lord. Just be with her wherever she may endeavor, Lord. Lord, I just know you're going to take care of her, Lord. We thank you, Lord, for just bringing her, making her our friend, Lord. And Lord, we again, we thank you for all that you've done for her, Lord. And Lord, we know you got great and mighty things planned for her, Lord. Lord, so just be with us throughout the rest of this day, Lord. In my prayer. Amen.